Americans are talking about President Obama's proposal to change the healthcare system. Notice I didn't use the word reform because so far the plans don't look like reform, it just looks like change, and some pretty radical change. Part of it is that the cost is going to be staggering. We're talking in terms of $10 trillion over 10 years. Now that doesn't make a lot of sense when you think that the current healthcare costs per year are about $2.4 trillion, and that's everything we spend. But the real problem is that 80% of that expenditure is toward chronic disease. We really don't have a health care crisis in America. We have a health crisis. And until that gets addressed, simply trying to put more people in a system, people who aren't taking care of themselves and who are going to create an extraordinary drain on the already overwhelmed system, will accelerate us into bankruptcy. This is insanity. There's no way in the world that we need to have the government picking your doctor for you or coming to the place, which is inevitable under this plan, of rationing. Now let me explain why rationing would be the inevitable result, because a lot of people say, well, how do you know that? Well, let me explain. If you have a fixed amount of money that you've dedicated toward health care, which the United States government would have to somewhere put a limit, just like we do with Medicare and Medicaid, and you put more and more people into it who are drawing more and more resources from it, the options are you just expand the amount of money that you put, which of course can't be legitimately done. The only other option is to start saying there is a limit on what kind of access people will be able to have. So the question is, if you're 70 years old and you need a hip replacement, does the government bureaucrat decide that you're actually just a little too old to get that and that you're not worth it? That's exactly where we're headed. And if you don't think so, look at the systems in Canada and England and in other parts of Europe where they have attempted to do the exact thing that President Obama is proposing for the healthcare system of America. This is not the course we want to go on. And there are a lot more reasons for which we won't have time to go into now, but I hope that you'll begin to do some serious reflection and study on whether you trust a government bureaucrat who doesn't know you, who's never lived in your town, and who will never meet you to make the healthcare decisions that ought to be made between you and your doctor.